Hi, I'm Dr. Bilal Ahmad Baba. I'm an interventional cardiologist at SHALBY Sanar International Hospital, Gurgaon. So today we will be discussing Tric valve or bicable valve implantation. So we had a patient who is a 66-year-old lady. She was a rheumatic heart disease patient who was operated in 2017. She underwent mitral valve replacement, tricuspid valve repair, and a bypass surgery in the same sitting in 2017.
6 months ago, he's starting to feel very bad. So we're starting to look out for the hospitals where we can make operation. And we decided that open operation is not the solution for her because of many problems she had with her. So we looked for mainly for the mini invasive operation. First, we go to another country, and finally we find out that Sanar is a good doctor, Dr. Bilal Baba, and we come to Sanar.
We examined her and we found to have right-sided heart failure symptoms more than the left. We did an echocardiography, evaluated the patient. We saw that the patient having a mild mitral valve dysfunction. She's having a torrential, severe TR with mild RV systolic dysfunction. Then we admitted the patient and we saw that on transesophageal echo that the mitral valve is mildly dysfunctional and she's having a torrential TR. So that is giving the right heart failure symptoms.
And made a procedure. Doctor said that open surgery again is not the solution for her. A new technology called Tric, and we should make that operation. We made the decision and we go through that procedure. Now she passed the operation, she feels good. So we hope that in future that problems will not come again.
We did a bicable valve implantation in which we are putting one valve in the superior vena cava, one valve in the inferior vena cava. So this backflow of the tricuspid torrential TR should be prevented. Into the backward flow should be prevented and the symptoms will get subsided and the organ damage will be prevented. So we have done this successfully, this surgery.
She passed the operation, she feels good. So we hope that in future that problems will not come again.